starting. All attendees are in listen-only mode.
Hello, this is Samantha Crane from the Autistic Self-Advocacy Network, and I'd like to welcome you to the third in our webinar series on making the home and community-based services rule work for you. Today we're going to have Rachel Patterson from the Association of University Centers on Disabilities. We will also have I'm sorry, I'm going to our staff, Faye Gordon from the National Senior Citizens Law Center, and Lisa Pugh from Disability Rights Wisconsin, and they'll be discussing how to implement the stakeholder engagement requirements and make sure that everyone who's going to be affected by the final rule is able to participate in the transition process and the process of implementing the final rule. Without further ado, I will give you Rachel Patterson.
Okay, thanks, Samantha. So I'm going to talk just a little bit about what is required in the rule for stakeholder engagement before Faye and Lisa talk about some tips for stakeholders about how to get involved and what they have done in a specific state in Wisconsin. So, some key dates. I'm sure we all know, but the rule was published January 16th of 2014 and took effect on March 17th of 2014 this year. States have 1 year to write their transition plans, and that is where most of the stakeholder engagement is required. So those plans are due by March 17th, 2015, unless, then there's this caveat, unless the states submit a renewal or amendment to one of their HCBS waivers before March 17th, then they're on a different timeline. Then they have to submit a transition plan for the services in that waiver with the submission, and then they have another 120 days to submit a transition plan for their remaining HCBS system. And what we've been seeing from states are really multiple plans, beginnings of plans, parts of plans, assessment plans, and this is what they're putting out for public comment. So this is good because we're seeing multiple opportunities for stakeholder engagement, and this I think is a, we're going to call it an opportunity to which we need to grab. Some of the plans that states have put out have been very short or had some things that I think a lot of people would disagree with, but I think the focus of this session is focusing on that as an opportunity to have another public comment period and get engaged. So these is just the basic requirements. This is what every state has to do. They have to post at least 2 public notices. They have to have a 30-day public comment period on their full transition plan, and that's an important word. The words full transition plan are in the regulation, and a lot of advocates in states have been arguing that what they have to comment on is not yet the full plan. It's only part of the plan or the beginning of a plan. So we're saying, you know, and I think almost in all states there's going to be additional public comment periods on that full plan. The state is then required to modify the plan in response to the comments they receive. If they make significant changes to the plan, they have to put it out for public comment again. They have to save those comments and submit a summary to the federal government at CMS. That's the Center for Medicare and Medicaid Services. If CMS wants to see the comments, the state has to have them saved somewhere to be looked at. Finally, the plan can be up to 5 years in length. Those are just your basic regulatory requirements, what every state has to do according to the rule. So now I'm going to turn it over to Faye, who's going to talk about some tips for advocates in stakeholder engagement.
Thank you so much, Rachel. Let's see, we'll just get started here. Thank you so much to Rachel and to the Autistic Self-Advocacy Network for inviting us to participate in this webinar and in this discussion this afternoon. I'm Faye Gordon. I am with the National Senior Citizens Law Center, and today I want to focus on some tips for consumer advocates who are working to be a part of the transition planning process and working with their states throughout the transition plan. A little bit about our organization. The National Senior Citizens Law Center is a national nonprofit organization. We advocate for health and economic security for low-income older adults. So we are thrilled to bring you this information today as part of our overall efforts to push for a robust state transition process as states seize this HCBS opportunity and work toward complying with the rule. So I have two goals for the work. Yes.
We're not senior slides, I'm sorry.
Oh my goodness, thank you for letting me know. Okay,
Yeah.
Let's see. Is this any better? No? Not any better?
I'm seeing, this is Lisa, I'm seeing the slides.
Oh, you're seeing the slides. Maybe I'm...
I can see them too.
Oh,
I see presentation goal.
Perfect. And that's all, just one big slide that says presentation goal?
I see that, yes.
Great. All right.
I'm going to assume that it's technical difficulties and we'll just move on.
Okay. All right. Please let me know though, and please use the chat box so I can see if there's if anyone else who's listening is having any problems, and we'll try and figure it out. Sorry for that. So again, just two goals for this presentation. First, I want to provide just a brief overview, building on what Rachel was explaining with the overall transition plan process. And then once there's a clear understanding of that process, I want to share some tips for individuals and advocates to use as they review their state plans and become involved in this transition planning process. And I'll pull some examples from existing state plans to help illustrate some of the areas for improvement and good things that we're seeing in different state transition plans. So here we go. First, a brief overview of the transition plan and implementation process. The purpose, as Rachel said, of this transition plan is to really detail how a state will comply with the rule. So for those of you who've had a chance to go through the full HCBS rule, you'll see it's very complex. This is not a simple programmatic change or just sort of a basic paper drafting type change. This really requires serious contemplation at the state level and a thorough assessment for states to determine how they can take advantage of this opportunity to really comply and make sure that they're providing Medicaid home and community-based services in truly community-like settings. And because this change is so complex, it's not something that's going to happen overnight or within the year, and it's not something that states should rush. But CMS does have a clear timeline for states to really get going and start actively working on this transition plan. So as we know, the rule was released in January and went into effect in March. But really this full year should be when states are digging in, working with consumer advocates, working with caregivers, providers with the full scope of the HCBS delivery system in their state and thinking through a draft transition plan and then working through comments and feedback to finalize that plan. So we know that overall right now, the way the rule is currently set, all of these state transition plans should be submitted by March 17th, 2015. So this past summer and spring was a busy time in developing either sort of general plans for plans or work plans as states work towards that final substantive transition plan. And so on that note of what is the purpose of this transition plan, if there's anything I hope you can take away from this presentation and share with your state, it's that the HCBS rule is really a huge opportunity for states and consumers and the HCBS delivery system. This really is the first time that CMS laid out very clear regulations to ensure that Medicaid home and community-based dollars are in fact funding care and services in the community. And this is a very welcome and very exciting change and it offers states this incredible opportunity to assess and evaluate their HCBS delivery system. So I really hope we, as advocates and individuals, can really see this as an opportunity and not any sort of a burden or process, but a really excellent chance to really think about HCBS deliveries, the HCBS delivery system. So in addition to the opportunity for states to assess their current system, the transition plan offers them the chance to also engage with consumers and engage with caregivers and engage with providers. There's a very strong emphasis throughout the rule that CMS is requiring states to seek and accept stakeholder comment and feedback. And so advocates and consumers need to really seize that requirement and push to be involved in the transition plan process, from the drafting process to the commenting process. And on that note, in addition to sort of this engagement on thinking about how a state is delivering home and community-based services today, it really offers states the opportunity to contemplate how it will continue to meet home and community-based services needs in the future. And so this should be a process of assessing current needs, but really thinking about what the state needs to do to build an effective HCBS system for the future. And then finally, a point that I'll discuss as I discuss tips for evaluating the plan, but a huge piece of this should also be ongoing, meaningful enforcement. So it's one thing for a state to look at their system today and to think about needs for the future, but if a state doesn't have a clear plan for enforcing these community settings and making sure that they continue to remain in compliance, all of this change really will not have meaning. So this opportunity to plan for meaningful ongoing enforcement is just as critical as thinking about current systems of today. So this is just a plug for a site that Rachel and several other of her partners have put together, the HCBSadvocacy.org website. So when we talk about state transition plans, as advocates, we are so fortunate that Rachel's organization and several others have put together this incredible website, because it allows us to have access to all of the state transition plans, updates on different state comment periods. And for me, I would say any information that I have in here was directly generated from this website, where you can go to each individual state, click on their transition plan, and see all of their key documents. And so thank you, Rachel, for putting this together, because it really helps all of us stay informed and engaged throughout this whole process. So this is an example, for example, of the Colorado transition plan, and this is a plan that's fairly detailed with clear deadlines, key stakeholders involved, a progress report. Other state transition plans may be more of bulleted hypotheticals or ideas of what they will do, but this is a pretty clear and thorough plan. So now that we have an idea of just why these transition plans are important and why we need to be involved, I want to share a few tips for individuals who are reviewing their state transition plans and getting involved in the comment process. So the first tip is to not confuse a work plan with a transition plan. These transition plans will require a lot of thought and a lot of assessment, and many states are initially submitting what appears to be sort of a plan for a plan or a work plan to determine that final transition plan. And that's fine, but that is not a substitute for a substantive transition plan for HCBS rule compliance. And so if you're in a state that has initially submitted this more general type work plan, just be very clear that your state is still required to solicit and accept public comment on their final substantive transition plan. So the state can't, make their work plan comment and their work plan public and seek comment on that, and then privately submit a substantive transition plan and not have a comment and feedback process. The entire process requires feedback and comment and engagement. And as advocates and consumers, we should really demand to be involved in the full process and comment on each piece along the way. The next tip is to be sure that you do not accept any sort of unsupported claims of compliance. And so several states we noticed in their initial work plan listed different programs and services and determined that those services were in compliance with the HCBS rule. And as you see here, these are examples from the initial Oregon and Pennsylvania plan. And they basically included very general blanket statements that they're offering particular HCBS services and these services are in compliance with the rule. And at that time, they weren't including any sort of support or backup for that claim. So as advocates are reviewing plans, if you see these type of blanket unsubstantiated claims, you should not accept that as any sort of evidence for compliance. Part of this process is thoroughly evaluating current HCBS programs. And if there's no thorough evaluation, then what is the point of the assessment? How is the assessment meaningful? And so advocates should demand a thorough evaluation of the state's existing HCBS programs as part of this transition plan process. So the third tip, and there's 4 tips, so this is the third of 4 tips, is don't accept reliance on provider self-reported data. We noticed as we were going through some of these initial transition plans that states were relying on providers to self-report their own data as part of the state's evaluation of community-based settings. And so this really drew concern because self-reporting of data doesn't, from a provider perspective, doesn't really offer a full picture on whether that particular setting truly is in compliance with community setting standards. And so there has been some improvement and some different methods that different states are taking to actually have a fuller picture of compliance data. So Colorado is relying on a provider survey. However, their plan also includes state site visits to verify that survey data. So it's not simply reliance on just self-reported provider data. Indiana has an interesting process where they're going to use their national core indicators data and provider surveys, family interviews, and stakeholder input to get a fuller picture of whether providers' settings are in compliance. And then Maryland, this is a little bit more on planning for their transition plan process, but this seemed particularly interesting and an interesting example for other states. They'll be doing several different surveys of participants and caregivers, case managers, and providers to inform them as they build their transition plan and evaluate their current home and community-based services settings. And so our last tip, tip number 4, and this goes back to my earlier point about the value and importance of enforcement, is that compliance should not be a one-time event. So if a state determines, hopefully through a thorough evaluation and through robust data from providers and consumer surveys and site visits and other indicators, that particular settings are indeed in compliance with the Home and Community-Based Services Rule, that should not be it. This needs to be an ongoing enforcement process. And so states are taking different approaches for this, and this seems to be a work in progress. Some are requiring progress reports, others are conducting ongoing assessment, or working towards quality reviews and provider monitoring. But a state in their transition plan really needs to have a clear and thorough plan for constant and ongoing enforcement of these home and community-based standards. And this is just, again, that broader point. So really make sure that these transition plans detail meaningful and ongoing enforcement. And enforcement should not be an afterthought in this entire process. I do want to be sure to share some additional resources with you. This is a lot of information, and one thing that's particularly challenging with this home and community-based services rule and with advocacy around the rule is that there's frequent guidance shared by CMS, and so sometimes we'll sort of update our understanding and change some of our tips and advocacy information. But we try and keep everything current on our website. We have 4 tips for advocates, these tips that I just shared in greater detail on our website. And then we also have 2 advocate guides. The first is a basic guide for the rule to help you understand all of the different pieces of the Home and Community-Based Services Rule. And the second is a guide to the transition plan process. And this is geared towards consumers, advocates, as well as states to help them understand exactly what they need to do to evaluate current systems and try and make their transition planning process meaningful. So I encourage you to check out those resources, and please contact us if you have any questions or need any more information on this. Thank you so much, Rachel, and thank you to ASAN for hosting us this afternoon. I look forward to the discussion at the end of this webinar.
So this is Lisa Pugh from Disability Rights Wisconsin. If someone can let me know when you see my slide.
Lisa, we're making you the presenter now. Lisa, we can see your slides.
Excellent. So hello, everyone. This is Lisa Pugh. I am the Public Policy Director at Disability Rights Wisconsin, our state's protection and advocacy agency. And I also coordinate the state's Disability Policy Partnership, which is somewhat of a new venture here in Wisconsin. That's a partnership between our PNA, our DD Council, and our state's largest self-advocate organization, People First Wisconsin. And we tried as best as we could to plan our strategy to respond to Wisconsin's state transition plan, and that's what I'll be talking about here, and some of our lessons learned and recommendations and kind of where Wisconsin is going forward. So we have actually now in Wisconsin seen 3 different transition plans submitted. We had 3 different home and community-based 1915C waivers that were up for renewal or that the state was making changes to that required a transition plan. So we've been through this process 3 times now. However, I have to say that we put the most of our effort in terms of public engagement, stakeholder engagement, into the first transition plan that went public in terms of creating awareness for people across the state, advocates across the state. And we have some lessons learned. I think that, so you'll see here the logo, we created a logo and kind of branded our campaign, Take a Stand on the Plan, and worked in partnership with the DD Council and People First Wisconsin. We feel like that collaboration really made our effort stronger. What we wanted to accomplish was really to figure out how to engage the most people. I think this is probably true across most states. We don't typically ask grassroots stakeholders, grassroots advocates to comment publicly on something this complex. So we really realized we needed to break down what is this federal rule, why is Wisconsin submitting something called a transition plan, and how does it relate directly to the services people are receiving in their homes, and then to try to do that within a 30-day public comment period. So we thought that a website that we would try to drive people to that had some easy educational tools incorporated into it was the best way to do that. We wanted a process that could engage self-advocates, so that meant providing tools and information that was, as easy for self-advocates to understand and in people first language. I would say that's something we could have done a better job at. We also wanted significant participation from, grassroots advocates that really believed in the community-based promise of this rule. And part of why that was really important in Wisconsin is because we have a lot of facility-based supports in this state, facility-based day services, facility-based employment services that we knew were going to be affected by this rule, and that advocates really needed to speak up about the benefits of community and how this rule could increase capacity for community supports, which I think was we knew would be a harder message to generate from the grassroots than a message about preservation of facility-based services. And then we wanted a process that was open to all views. We wanted to make sure we were communicating what the rule was about, but realizing that there would be people in our state that would be wanting to preserve a facility-based model, and we're going to be commenting on that. But we definitely wanted our comments to be promoting, community integration, and so we had to figure out what that balance was. So our strategy here, and again, this was our first transition plan, so we were working within a 30-day time frame. We tried to do as much prep work as we could in the time leading up to when we thought the state would release the plan, was to kind of hit multiple audiences. You are seeing in these bullets on this slide the benefit of our kind of post-armchair quarterback review here. Some of these strategies were stronger than others, and I'll make recommendations at the end about what I think other states could do better than what we experienced. As I mentioned, we were really working for a strong grassroots engagement across multiple audiences. And when I say multiple audiences, I'm talking about getting self-advocates to comment on the transition plan and provide a perspective, for family members to provide a perspective, and then for providers of community-based services to weigh in. We also had a professional advocate strategy, and what I mean by that is we have a statewide survival coalition of 30 disability organization members that provided very detailed and technical comments. That was a different expectation of stakeholder input than what we expected out of our grassroots strategy, and I'll talk a little bit about that. We also had a social media strategy. As I mentioned, we really wanted to drive people to the website, which we considered to be an awareness tool, and to engage them in, wanting to comment. So we used Twitter and Facebook and other means to do that. We also realized that being proactive on the media end was going to be important. It actually became more important as the 30 days rolled along. And then kind of a last-minute strategy that we engaged in that I'll talk about was educating our legislature, and that I think is something that all states need to be aware of. So this Take a Stand on the Plan website was something that we dreamed up in a very short amount of time. Again, the focus was on awareness and then providing a simple tool to help people create comments. So what I'm going to try to do here is take you right to the live site and see if we can't walk through some of what's on here. So you see, it is really pretty simple. If folks clicked on this tab, they would be taken to the survey tool that we use that I'll show you in a little bit. And then up here, we just had different informational tabs for the different groups we were targeting. So advocates and families, what is this transition plan? This is a short tutorial video. When I say short, I think it was around 7 minutes long, where we actually walked through in a closed caption video what the plan, Wisconsin's plan, was about, and why people should want to comment. And then another tab we had here was for providers and professionals, a little more technical information for people wanting to comment. And then you'll see over here, our Twitter feed, some suggestions on what people could actually tell the department that would be helpful feedback on the plan. And then we linked to paper copies of the plan, told people how to submit, and then, of course, linked them to the actual plan. If you go to this website that we're talking about, is www.takeastandontheplan.org. This link to the Wisconsin Department of Health Services plan is actually is dead right now. They took it down as they are making changes, so you aren't able to see that. I want to show you really quickly a piece of this social media campaign in one of these short videos. The audio is going to be hard to hear, but all you have to know is this is a 30-second PSA that where everyone pretty much, people with disabilities were at our Disability Pride event, and they all say take a stand on the plan. So let's just see if this will play for us. So you get a kind of a little bit of a taste there of what we were trying to get at in kind of engaging some interest and excitement into our campaign. We really were trying to put things in plain language for people. And so if you would click on this submit your comments piece on the website, what you would go to is a survey that we created. And again, a very simple tool that we created in SurveyMonkey. And we basically were, again, trying to accomplish two things: educate people about what the rule was about, why the state was required to put forward a transition plan, and then to ask people questions that would solicit their experiences with community-based services or lack thereof. And I think in terms, so we had 3 different versions of this survey. People would tell us who they were. You see at the bottom, you're a person with a disability, you're a family member, or you're a paid provider of services. Depending on what you clicked here, you would go to a different version of the survey. I think the lessons learned here was that it was really hard to reach the self-advocate population and to get the sort of input that we were hoping to provide to our department. Most of the self-advocates we were able to reach were people who were already living and experiencing community-based services to a significant degree. So in that way, they were able to speak about their community experiences, but they really didn't necessarily, they weren't able to share a perspective on what needed to change because they hadn't had that personal experience. So I think if we had more time, or if we would do a campaign like this again, we would maybe do more community conversations, more actually out in the community talking to self-advocates and kind of asking questions and documenting their experiences in a way that I think would provide more robust input. In terms of the family and provider engagement, we got some really nice results. We think it was very important to kind of back up and do that education with that 7-minute video and some of the other information we were sharing. And then through the survey, if you're able to go to the website, www.takeastandontheplan.org, you'll see that the questions that we asked were aligned with different parts of the rule, and it really helped people to tell their stories. So again, we were trying to fill in the gaps. Our state really did not have any public education campaign at all. They literally put their framework of a work plan up on the website and opened up a 30-day comment period. And so I think to expect robust public comment on a document like that was not going to happen. So we felt like it was our job to kind of connect the dots for people. What we have done since then is develop an FAQ and tried to perfect that a little bit. So I'm going to show you what that looks like, and I can share this afterwards. So you see it's branded as Survival Coalition. That's our statewide Survival Coalition. And we got a sense through the website and the survey like what questions people were asking, what things they didn't understand, and really in particular some of the misinformation that was out there. Our state did not correct any of the misinformation, and through the 30-day comment period, we really realized that those myths, if you want to call them, were pervasive and were making their way into the legislature. They were really kind of getting out of control. So our next step in Wisconsin will be a greater distribution of this FAQ, which again I can share with folks afterwards. So I would recommend people thinking about what information people need and easy formats to share that in and distribution of that. So a lot of what Faye and Rachel said about the content of plans was certainly true in Wisconsin. There are a lot of things missing from our plan. Many people have called it a plan to plan, like in other states. Not to say that there aren't good parts of it, but I think that our job obviously is to make this a really robust process and to communicate back to CMS that states really do need to do a better job at this, really important juncture. So I think what we saw in Wisconsin was a lack of stakeholder engagement, really, like I said, a posting of the plan, but not really helping people to understand how to provide good feedback. That people experiencing the waiver programs who were really going to experience changes in home and community-based services were not engaged at all, except for the work that we did. And so we thought that was a really important perspective that was that would have been lost otherwise. There's some discussion of assessment across settings. We are continuing to monitor that. The way it currently looks in Wisconsin, we have a really large managed care system in our 1915C family care waiver, and those assessments will have been handed down from the state to the managed care organization. So we are thinking that is not a robust process that is free of conflict of interest. So that was a major item that we commented on. Also, the ongoing monitoring and enforcement was something that we, in our, professional advocate comments, really commented strongly about. And then the provider capacity piece, to us, was probably the most critical missing element. So when you think about it, as these providers are being asked to change how they deliver supports every day in order to comply with the rule, what's in their place? And Wisconsin, I think, like many other states, hasn't created a great variety of community-based day activities. We have some pockets of really great community-based employment supports, but the information we were hearing from families and providers, where there are many parts throughout our state that have absolutely no capacity at all for community-based supports. And that was something that was not mentioned in Wisconsin's transition plan, was if certain settings or certain providers were no longer going to be able to participate, what was going to take their place, so that people would have a place to go, people would have supports in their plan that actually met the new requirements. And I think that will continue to be a concern for us. So how good of a job did we do on our grassroots engagement? I think although we, hindsight would say we could have done a better job, I think we did pretty well. We had 466 survey responses. A good proportion of those were family members, almost a third self-advocates, and then, of course, providers, each giving a good perspective on what was going on in Wisconsin and what needed to change. Again, that overarching message, I think, that we hoped came out strongly to the state was that there aren't community-based options in a lot of communities across Wisconsin, and that is really what is limiting integration and full compliance with the rule. Something that we thought about initially and probably could have planned better for was around media. I mentioned that we have a strong facility-based employment, facility-based day services structure in Wisconsin, which meant there were a lot of people who were hearing from providers that this was a bad change and that it wasn't going to result in good things for people. And we started seeing this pop up in letters to the editor, editorials, newspaper articles that were driven by facility-based providers. We tried our best to be proactive. What you're seeing on the screen right now is guest editorial, about 500 words, that we were able to place in the state's largest daily newspaper, the Milwaukee Journal-Sentinel. And the folks who are the authors on this article are Kevin Fetch, who is the chair of our DD Council, Cindy Bentley, who some of you might know. She's the executive director of People First Wisconsin Self-Advocate Organization. And then Laura Owens is the most recent past president of National APSI, and she also is a provider of community-based employment supports in Wisconsin and works as a special education professor at the University of Wisconsin-Milwaukee. And so we, helped to write this guest editorial for those folks and figured they were very credible people to sign on. So and this appeared the day after the state's transition plan went public. So we worked in advance with the editors of the Journal-Sentinel to get this placed. And I think it really helped to set the tone to be proactive and get this message out there. We also, encouraged advocates to write letters to the editor during that 30-day campaign, which was very important. But this was something that we struggled with, and I would encourage states to pay attention to this strategy. Another strategy that we kind of figured out later within our 30 days was the need to educate legislators. So what you see on the screen here is a photo of a legislator tour that we conducted near our state capitol. And in this picture are a few legislators and staff from key legislative offices who were visiting the Office of the Commissioner of Insurance, where they are a great model of community-based employment with people with significant disabilities. So legislators, by the time we coordinated this tour, and we've now done the tour twice, and there's been a waiting list of legislators who are really interested in what this employment looks like. Legislators were already hearing from providers and family members whose loved ones work in facilities saying that this change is bad, there's no way my son or daughter can work in the community, the federal government is forcing something on us that we can't possibly do, we already train and place as many people in the community as possible, this is a safety net that needs to continue to exist. So the gentleman that you see in this picture here that I'm pointing to is a representative from the Green Bay area. His name is Representative Genrich, and he has a very large sheltered workshop in his district. And he said, Lisa, I really would like to see what community employment looks like for people with significant disabilities. So he kind of generated the idea for this tour, and what he was able to see at this employer plus two others that we constructed with the help of the county was very high best practice examples of job carving, customized employment, job coach fading, what they call partners in businesses, which is actually a co-worker mentor model, which is something you can use Medicaid funds to pay for, where a co-worker colleague actually receives an enhanced wage to provide the sorts of natural on-the-job supports to someone. They saw job accommodations for a person who uses symbols to speak. It was very eye-opening for all the legislators, and we actually had governor staff who participated in this tour, and I would highly recommend thinking about this as an educational strategy going forward as we're helping people to visualize what high-quality community supports look like. During this tour also we shared, the wages of these individuals, how many hours they work, and also what they do during other times. Most of these people with significant disabilities who work at this particular place also have other jobs because their jobs are job carves. These aren't people who work 40 hours at one position. They have actually a position that's customized to their skills, as best practice supported employment tells us. And so these people have very full lives, full weeks that include employment and other activities, and it was exactly what these policymakers needed to see. So some recommendations from things that we've learned. I think I've talked about this, being proactive with the media, thinking about press events, letters to the editor, thinking about what a guest opinion piece needs to say. October is a perfect month for some of the employment parts of this conversation because it's National Disability Employment Awareness Month. How are we talking about the value of community-based employment during this month and sharing examples that people can learn from? Basic themes for professional advocate input. I told you how we stressed the lack of community capacity. That became really apparent in Wisconsin. It might be a different theme, but I think it's important for everybody to be on the same page with some main messages. And then really looking at your state. Are you going to expect, some of the media problems or some of the legislator awareness of problems that we did? Or is it really important to engage self-advocates or community-based providers more in your strategy? And then don't forget about the legislators. That, I think, could become a huge problem in our state and probably others as they try to figure out if they have a role in the implementation of this rule. So now what's next in Wisconsin? I mentioned that we have posted 3 waiver transition plans, and the first one was perhaps the most robust input from us, although we have been weighing in on each because we've heard that advocate input, public input is going to be extremely important in how CMS responds to these transition plans. I would encourage more engagement with self-advocates. Like I talked about, maybe thinking about a community conversation strategy where you're actually talking one-on-one with self-advocate groups and getting them to talk about the value of community and what needs to change in your state. That bullet point around unfortunate fear-mongering, what we found out within the 30-day time frame is, and you can actually see this on provider websites in our state, was that providers of facility-based services were putting out information to family members that said, as a result of this rule and the state's transition plan, that their son or daughter would be sent home without anything to do. And some of the information they sent actually said, by January 1st, your son or daughter will be home with you on the couch, or your son or daughter will be losing his or her friends. And so legislators were getting those flyers in their mailboxes, and people with disabilities and family members were getting those flyers home with them. And as you can imagine, it created, and is still creating, a great amount of fear. And we thought it was unfortunate that our state didn't step in with more objective information. So that's part of the reason why we're developing these FAQs to try to, mitigate that and provide more objective information as best we can. And then we're continuing to look for, more concrete ways to describe quality community-based supports. So basically, what does a full life with community-based supports look like for people with disabilities in Wisconsin? A lot, like I mentioned, a lot of people, who go to a sheltered workshop and then go to facility-based day services, what we're hoping is that within 5 years that we won't be so reliant on facilities, but because we haven't developed a community-based day, a community-based life for people, it's really hard to envision that. So we're trying to describe it, trying to find good models of it, and trying to really, help people feel comfortable with that idea. And that is all I have.
All right, we are going to open up for questions. Does anyone, I'm not really seeing any questions. If someone has one, please feel free to enter it into the question screen at this time. The one question I do see is one person is asking for clarification. Does the plan have to be made available in 2 public notices and the public has 30 days to comment before the plan is submitted by March 17th? Or is that after the plan is submitted by March 17th?
This is Faye. I can take this question.
This is Rachel. I'll jump in on that.
Faye, do you want to go ahead and also weigh in?
Oh, sure. So the draft, the state has to submit their draft transition plan for public notice and offer that for 30 days. Then the state is supposed to, according to the original rule, go back and make changes and incorporate comments from the public. And then they have to submit that plan to CMS. All of this has to be done before March 17th. What has changed since the rule was originally posted is that states are submitting these more informal work plan, plan for plan type documents. And so as advocates, we are pushing to make sure that in addition to offering a comment period on those documents, when the state then develops their substantive transition plan, they again have to offer a 30-day comment period. And we've heard some discussion from people at CMS that this is on par with what they're going to be expecting of states. So we expect that consumers will have the opportunity to comment on each piece of the transition plan documents. And all of that needs to be complete before March 17th.
Thanks, Faye. Lisa, do you want, I'm sorry, Rachel, do you also want to weigh in?
Nope, that was perfect.
Oh, you're cutting out a little bit, Rachel. I'm sorry. That was fine?
Yes.
Great. I don't see any other questions yet. One person says, will the webinar recording be available after the broadcast? The answer is yes, as soon as we clean up the CART transcript, so it usually takes about another week or so, but we will then upload it to the internet and people will be able to see it. Another person says, well, what happens if a state does not submit a plan by March 2015? Rachel, do you want to take that one?
Sure. That's a really good question. I'm not really sure. That would really depend on how CMS at the federal level decides to respond. I don't know. Faye or Lisa, do you guys have any ideas? That wasn't really something that we thought was a possibility.
Yeah, I don't think there has been any direct information from CMS on sort of how they would reprimand states or what they would do to ensure that states do produce a transition plan. But I think there was something in the rule that indicated that there will be an enforcement process on CMS's end to make sure that all states are active in developing a plan, but I can't remember. I don't think there was really any specifics on what that would be.
I will add something that is in the rule, which I think is a good change, is it changes and gives CMS a little more flexibility in their enforcement of their regulations for waivers broadly. For a long time, if a state was out of compliance with a waiver, the options for CMS were to continue the waiver or to end the waiver. And eliminating a waiver doesn't help anybody, especially people relying on the services in that waiver every single day. In the new rule, it creates sort of a little more in-between where CMS can remove or delay federal financial participation, that's their payments to the states, because a state is out of compliance. I don't know if that's what would happen if they didn't submit a transition plan, but I think it is one of the other things in the rule that doesn't get as much attention, but will be really useful going forward for times when CMS does need to enforce its own regulations.
Okay, so I'll go ahead and read the next question. So the next question goes, you distinguish between a work plan and a transition plan. Are you seeing states submit plans called transition plans that aren't truly a full transition plan?
Yes, so we did see states, particularly over the summer and in the spring, submit plans that were very draft-like in nature, that were much more of a plan for a plan, a transition plan. And states since then have become more specific if they are going to be submitting several different layers of transition plans. So for example, California is currently in the first comment period of its transition plan, and the state was very upfront that this is a general work plan to gather feedback from stakeholders about what those stakeholders want to see in the final transition plan. So there's a 30-day comment period right now where stakeholders are invited to submit information on a very general plan for the state to develop their more substantive plan, and then 30 days from now, well, not quite 30 days because this has been open for several weeks, but at the end of this comment period, the state will then develop their substantive transition plan, and that will be open for comment again.
Yeah, I should add that states have been submitting, or I should say states have been posting plans under a variety of names. Sometimes they're called a statewide transition plan. Even if advocates don't think it's a full plan. Sometimes it's called a draft plan, sometimes it's called an assessment plan, and the name is informative, but I think does not, you really need to dig into it to figure out what exactly the state has in their plan. The name does not always match how robust we think the plan is.
So another question is, whether anyone has heard of the kinds of appeal processes that might be in place in which disability groups or individuals could challenge a state's determination that a setting was community-based.
I don't know of any formal appeal process. I think that would have to be through the public comment period. And then if you disagreed with the state's determination, probably submitting comments to CMS. Faye, do you remember?
I'm not aware of any formal appeal process anticipated in any of the state plans, but I know that this is a concept that different advocates and states are discussing. So both on the provider side and on the consumer side, if the state determines a setting is not in compliance, how would either one, or it is in compliance, if either one disagrees, how they would appeal. But I haven't seen any examples of that in the states. It doesn't mean that it's not out there, and if it's out there, it's on the HCBS Advocacy website. But I'm not aware off the top of my head of states with that specific example.
The other thing that I should point out is that, you know, as when states get comments from disability organizations, they will at the very least have to sort of respond in writing to the comments at the end of the comment period. So that could help, you know, sort of set people up. If they still disagree with the state's determination, that would be a good time to follow up and go to CMS. Does that sound about right?
Yeah.
Yeah.
And I'll add, I know some folks have been worried that their comments won't be posted publicly. The state is not required to post everyone's comments. But if you would like your comments posted somewhere, we are happy to post comments that people have submitted on the HCBS Advocacy site, just so that they're seen by more people.
Another question is whether CMS or states have addressed the question of grandfathering in settings that don't qualify under the new regulations, but in which people have been living for a long time, maybe for several decades. Will those people be grandfathered, or will they be transitioned out?
Lisa, I can speak a little bit to that, is our Department of Health Services Secretary sent a letter to CMS asking for some clarification on whether or not all settings would need to comply with the rule versus whether or not it would be acceptable as long as someone was provided with a choice of a community-based setting within a continuum of choices. So it doesn't deal with the grandfathering specifically, but what our secretary was asking was, you know, would a disability-specific setting still be compliant as long as the person had been provided with a choice in line with the person-centered planning components of the rule. And on just last week, October 7th, CMS answered Wisconsin, and basically they reiterated that the rule says that the rule applies to all settings in which Medicaid home and community-based services are provided, including non-residential settings for employment-related services. Any additional guidance that CMS provides will be in line with the requirements of the final rule. So I think, you know, how we were reading that was basically that a disability-specific setting would, even if someone had lived there for a very long time, if it was not in compliance with the rule, would not be allowed to continue to receive federal home and community-based dollars. That doesn't mean that a state could not choose to fund such a setting or continuation of a setting on straight state dollars, and I think we're seeing some state legislatures do that in terms of a grandfathering in small amounts. But I'm not sure. I don't think that that's something that we would propose in Wisconsin, at least not right now, just because there are so many people and it would be really hard to define who gets grandfathered and what's the criteria for grandfathering.
The other thing, this is Samantha, I'd also want to add that, you know, states have 5 years to come into compliance, and that is going to give states some time, if they decide to actually make the most of it, that's going to give states some time to really work on transitioning people into new settings or bringing existing settings into compliance if that's possible. So, you know, there might be some settings that are disability specific right now and are not in compliance, but with retraining in 5 years, people, you know, you might be able to get the setting into compliance, and then people wouldn't have to move. So these are things that states are just going to have to think about in terms of which approach they want to take. Another question is that would we be assuming that by the time the state puts out a transition plan, they should have already done the required assessments?
That's a good...
Oh, Rachel, do you want to take that one?
Oh, no, go for it. I'm going to try and look something up quick.
Okay. Rachel, can you go on mute? Does Faye or Lisa want to take this one?
This is Faye. I'm trying to think if there's an example of any state that has conducted this assessment process before developing the transition plan, and I just don't think time-wise that has necessarily happened. So I think what we're hoping for is that the transition plan will detail what the assessment process would look like, maybe in that initial work plan, and then the more substantive transition plan would explain sort of how that was conducted. But I can't think of a state that has already conducted those assessments unless they were simply relying on these sort of more blanket statements that particular settings are already in compliance without actually conducting any sort of assessment, and that doesn't seem to be the process we're hoping for.
Do we think that there's a possibility that states whose deadline is in March, so they'll have had basically a year to plan for this, will as we get later on toward the later deadlines, is it more likely that we'll be seeing states proactively conducting these assessments before their plan is due?
If advocates are pushing for that, I think it's a possibility. You know, it's a tricky situation because on the one hand, this is a very tight deadline of basically a year. On the other hand, it's a year, and advocates have been elevating this issue for a while and really pushing states to take this opportunity. So this is something that I think would require a lot of pressure to make sure that states really do finish these assessments by that time period. But it's not impossible, but I think it would require some strong advocacy.
This is Rachel. The papers I was rifling through to find was CMS's official guidance on the transition plan. And it does say under what does CMS expect to see in a statewide transition plan, they expect to see a detailed description of the state's assessment of compliance with the home and community-based settings requirement and state the outcome of that assessment. So to me that says two things. One, I think it's further evidence that I don't think we've yet seen what we could consider to actually be a statewide full transition plan, because I don't think we've seen the outcomes of a robust assessment. And I would think then that states have to submit this by March 17th, based on the way that CMS described it here.
I think that CMS might have been, at least in these early months, within the first 6 months of the rule coming into effect, there was a sense that CMS was going to accept states' transition plans that really didn't include that level of assessment based solely on the assumption that they just didn't have time to do that. And that guidance that Rachel was mentioning, in which they said that they really would expect states to have conducted this kind of assessment, that guidance came out just a few months ago. And I think they're trying to, Rachel, would you agree that they're trying to reset the expectations, that they're sort of saying, look, we were letting people get away with not doing this in the first few months, but we're really going to try and raise the bar towards the end of this period?
I think so. I think at the beginning, states had to put something in writing to continue their waiver, and I understand that. But I'm glad to see CMS saying just what you're saying, that, you know, okay, now you've had some time. This isn't news anymore. We need to have a full transition plan.
And this is Lisa. In the communication that Wisconsin had directly with CMS during our initial public comment period, our state secretary of Department of Health Services had basically said we are not able to include a comprehensive assessment of non-residential settings until CMS provides the additional guidance that they had promised on non-residential settings, which everyone knows is not yet out. And when CMS replied to Wisconsin on October 7th, they basically said back to Wisconsin's specific question again that the rule applies to all settings, that all settings need to comply, and that any additional guidance that CMS provides will be in line with the requirements of the final rule. So I think what that was saying is CMS is saying you need to have be submitting to us a comprehensive plan that discusses the assessment of current HCBS settings regardless of how much guidance is out.
Thank you. The next two questions I'm just going to answer real quick because they're very straightforward. One is, how can we find out if a state has submitted a plan to CMS? And where can I find the text of the rule? And the answer is that the HCBS Advocacy.org, which is run in part by AUCD and many other disability organizations, is a really great clearinghouse for state-by-state information, and I believe it also has a link to the text of the rule. Rachel, would you like to talk some more about the HCBS Advocacy site?
Absolutely. So we have a page for each state and the District of Columbia that have to write these transition plans. And on that page, we have posted their waiver submission deadlines and any information that we're getting from the state, from their official state documents, any websites that they've created or web pages they have about the rule, if they're having stakeholder engagement meetings, and we keep things posted. One of the things, unfortunately, that we've discovered is we were linking to a lot of transition plans that the states have then removed, and we didn't save them all to my hard drive. I think I learned that the hard way. But I've left it up there just to show that the state had a transition plan that they posted at some point. So for the most part, if your state has made it public, it should be on the site. We also post news articles, so if people are writing both general reporting or opinion pieces, those are posted on the site. We have 2 more pages. One of them is just advocacy resources, so things that national groups, for the most part, are putting out about the rule, about how to advocate for community-based services, that kind of thing. And then a whole other page that's just information from the federal government. So the text of the rule, their accompanying informational bulletins and fact sheets, all the guidance that comes out, as well as some really important guidance from the Secretary of Health and Human Services regarding person-centeredness. This is not something that was required in the rule, but actually something from the Affordable Care Act, but it matches well with the rule, and I think is important to take a look at. I'll also add that the website is something that the disability community is doing, but it's also something we can't do without you. If you go to your state page and you see that something is missing, let us know. There's a Gmail link on every page. If something is missing or not working, we try to stay on top of all the states as best we can, but we do miss things, and so really rely on state advocates to let us know and send us links and keep us updated on what's happening.
Okay, great. Yes, I'd like to read out the next question. So we have been told that that our state department that is developing the transition plan will respond to comments in summary and not as a one-by-one comment. Is that allowed?
I think it is.
I would want to go back and
the rule,
check with the rule.
The rule does talk about submitting a summary to CMS. I don't remember if it says that they have to respond to each comment.
Yeah, I agree with Rachel. I don't remember anything saying.
One thing that you might want to sort of look for reference is if you look at the final rule itself, the one that was published in January by CMS defining home and community-based services, they have a long comment and response period, or a comment and response section, in which they're responding to people's comments on the rule itself. And they are not responding one by one to comments, but they're responding substantively to the issues that those comments were raising. So they'll say, some commenters expressed this concern. Here is our response to this concern. Now let's move on to this other concern. Here is our response to this other concern. Is that what we should probably expect from states as well?
I would hope so. I would hope that is what they take. It might depend on state requirements for how their process works. I don't think that the rule requires them to respond to the comments. I think it requires them to save the summary and submit it to CMS, which is not posted publicly.
This is Lisa Pugh, and I would agree with that. We are now, our initial public comment period on our very first plan was ended on September 2nd, so we're 30 days out from that. And one of our attorneys actually sent a message over to the person at our Department of Health Services inquiring about where, what's the state of this, how have you responded to public comment, basically asking, can you tell me when the Department of Health Services plans will be to make these documents public, and could you provide us with comments of the responses to both the waiver changes and the transition plan? And the response back from the department was, we are in receipt of your open records request, and it has been forwarded to the records custodian. So it was perceived as an open records request, which we thought was interesting. So we don't know how long it will take for us to get that information.
Someone says they're confused about where to find the actual text of the rule. The website has a lot of summaries, but what is the site for the actual rule?
That's a good question. If you go to learn about the new rule under HCBS Advocacy, I understand there's a lot of stuff posted on here, I think because there's so many pieces of information. But the first link on the bulleted list is the final regulation, and that'll take you to the federalregister.gov where it is posted.
And one thing that might be disorienting when reading that Federal Register page is that it starts with a summary, right? So you will see a summary, you'll see a long question and advocacy section, and then it's really sort of towards the very end that you get the actual text of the final rule.
Yeah, unfortunately, Federal Register posts are not easy to read.
One thing that, Autistic Advocacy, the Autistic Self-Advocacy Network, we published a toolkit. It's on hcbsadvocacy.org, and it's also available on autisticadvocacy.org/HCBS. If you search our site, and actually, I'm sorry, I said search our site. I gave you the actual URL to our toolkit. It's the autisticadvocacy.org/HCBS. On that website, you'll see a guide for advocates. Our guide for advocates, it's sort of aimed at self-advocates and their families. But at the end of that guide, we've just reprinted the entire rule because the Federal Register site can be a little disorienting to people who haven't seen regulations before and are not familiar with that format. We're not seeing any more questions. I will leave the questions open for, oh, here's one more. Are the territories submitting state plans such as Puerto Rico and Guam? HCBSadvocacy.org doesn't have information on them. Do they have HCBS waivers or do they receive funding? I'm not actually sure of the answer to this. Does anyone else know?
I do know that Medicaid differs in every single territory in terms of what is offered and whether or not, and how the eligibility works. And because of that, we focused on the 50 states and the District of Columbia. Does anyone else have any? We have really just not heard anything from the territories about their relationship with the rule.
Yeah, I'll be honest, I did not know this either. And I just quickly Googled it, and it looks like the rules changes to some of the waiver process type pieces does affect eligibility or does affect Guam, Puerto Rico, and the Virgin Islands, but I don't know if it requires a transition plan type change. So the question is I don't know. I think we would need to look through the rule.
Does anyone have any final comments before we close? Not, oh, some more people, or nope, that is the final question. Thank you everyone for attending our webinar. Since there aren't any more questions, we're going to close a little bit early. Please join us next week, the October 14th at 1 o'clock for our next webinar, Applying the Final Rule to Employment and Day Services. We'll circulate the slides after the webinar is over, and a video and transcript will be uploaded this week. Thank you.
Thank you.